So here we are on part two. Um, the next thing that I was going to talk about was actually every day I had to, when I was diagnosed with cancer, I had to go and get radiation treatment and also be hydrated. In other words, injections in order to have fluid in my body to make sure. Well, in order to get there, and also they wanted to make sure I was able to eat. In order to get there, one of the next surgeries they had to do on me was to put um, a feeding bag into actually into my belly. Um, a little bit at first intimidating to me since I hadn't really ever been in surgery or knew anything about surgery. It was actually very intimidating to me. I went in for that day, and actually my mother um, took me in that day to get the stomach tube in. Um, they went in and poked this thing down inside me while I was asleep. And then when I woke up, she said, "Well, everything looks like it's going just fine. You're ready to go home." And I didn't feel fine. I don't know, I felt funny. And maybe it was just from the anxiety or from the worry or concern about having something poked inside me and hanging out of me that I had never had before. But what I did was, what we came back to, and I was going to stay with Mother for a day or so and see how it was going. We got back here to the house, I mean her apartment, and when we got to the apartment, um, I just started feeling worse and worse and started turning white. Mother kind of described it as turning white as a sheet. So she had me call the nurse, and I called the nurse and told her what was going on, and my blood pressure also had started dropping. Blood pressure usually runs kind of high, 170 over 98 or so. Is really all that strange for me on medication. But at the time it was dropping down to like 110, getting close to 100, 110 over 60 or 70, and 105, and just kept dropping. So she got me in the car, and I passed out on the way there. Maybe because I was tired, maybe because of the drugs they gave me for sleeping, I don't know. Anyhow, by the time they got me to, we got back to the VA hospital, they decided that my blood pressure had dropped enough and started intravenous on me and put me in the hospital overnight. Again, um, don't know why, no real explanation for it. Next day I was let out again, so, and then the next um, procedure they had to do was put a thing that went into my heart. It went underneath my arm. Um, it was a direct line for hydrating me and for putting other kinds of medications like chemotherapy right directly into. And what happens is it went into my arm here and went right directly into my heart. Um, they have a name for it, and by the next feature I'll try to make sure that I have the name so I can say what it was. So now I had two things sticking me. And in order to do this procedure, again it was kind of like a outpatient surgery type of thing, or they actually had to x-ray it afterwards to make sure it was in the right place. First I had to wait, and then when I went in I had to be prepped for surgery. They cleaned up the area, then stuck the thing in and ran it through a vein until it dropped into my heart. And it was just a new experience for me. It's frightening. But that one went a lot better than the last one. And the first time that they went and took a x-ray of it, they saw that it needed to be pulled back a little bit. It was actually too far in. So I had to wait for the lady to pull it back just a little bit. And she already had somebody else in there that she was doing the same procedure with. So I sat out in a chair until she did that. And I was just woozy that time, I know, because it was just a strange experience for me. So when that was done, now I was ready to start my treatments. And what I had ahead of me was 45 days of radiation treatment, 5 days a week, Monday through Friday, except for days off like 4th of July, that kind of thing was coming up. I think 4th of July was the only one interrupted. And I had the weekends off. Whoopee. At the time I was renting a room from somebody in a house over in Vancouver area. Here's what the procedure was. I actually had to find somebody to give me a ride to the VA clinic over in Vancouver, and then from the ride I'd catch the bus in Vancouver and ride the bus over the bridge to VA hospital. And at the VA hospital I'd get out and go to whatever my procedure was at the VA hospital, and then from there walk the Sky Bridge over to OHSU every day to take my radiation treatment. Now, getting a ride, the biggest challenge it seemed like every day was getting a ride. I had a lot of people, very nice, very sweet people, say, if you need anything, a ride or anything, just let me know and I'll make sure you get a ride. Well, I had to have a ride in the mornings by 7:30 in order to catch the bus in time, in order to get to the VA hospital in time, in order to be there for my first procedure in time, my first procedure being hydration at the nurse's floor on a 4th floor of the VA hospital. And then I had that, and that usually took between 3.5 to 4 hours, and then after that, and then I'd have to walk over the Sky Bridge to OHSU, almost clear to the other side of OHSU in order to get my radiation treatment. People have good intentions, and they mean very well, and I know that they really wanted to be there for you, but then when it came down to it, you have a little bit of anxiety because you don't want to miss that bus, but you don't want to put anybody out either. And so you feel bad about saying, you know, this is every day, 5 days a week, are you sure you can do this? They say yes, and they want to every morning, but there's some times when life gets in the way and they just absolutely can't do it every morning. So there were some mornings that I'd have to try to call somebody else because one person wasn't able to make it, and hope the other person picked up the phone, much less come and got me. I want to say that during this period of time, this was just right after Nelson having passed away, and there was a plethora of people that continually let me there was a plethora of people that continually let me know that they and their prayer group, prayer circle, or people around them were praying for me. And the Lord was very gracious. I didn't miss one of the treatments. I had some anxiety a couple of times, but the bottom line is I really didn't miss one treatment. And every morning my thing was to get up, get a shower, and at the very beginning it wasn't too bad because I want to say that although I had some anxiety about it, and I had a sore throat from the surgery because they'd done the surgery on the cancer, I wasn't feeling horrible, so it was just more anxiety than anything else. And this went along for about, well, it was 45 days, so it went along for 45 days. So I'll talk more about that in the next one. Thanks, and we'll see you soon.